Welcome back. During Tuesday's presidential debate, President Trump and Joe Biden made a lot of medical claims regarding the COVID-19 pandemic. Here to fact check what was said that night is our 9 health expert, Dr. Payal Kohli. Good morning, Dr. Kohli. So my first question during the debate, Joe Biden said if Americans wore masks, 100,000 lives would be saved. So where does that information come from and how can we predict the future?
So, Natasha, this information comes from the IHME model, which is the University of Washington model that the White House has been using. And essentially what the model says is that currently about 50% of Americans are wearing masks in outdoor settings. If that number increased to 95% of Americans, we could save 95 to 100,000 lives by January 1st. So that's where Vice President Joe Biden was getting his information from. But I do want to remind everybody that models are really assumptions. They're scientific guesses based on inputs put into the model, and that can obviously change if our behavior changes or the weather changes. So it is a guess, really, at the end of the day. But I think the message from his comment was clear, which is that masks save lives.
President Trump said Dr. Anthony Fauci said masks weren't good and then changed his mind. What have health experts said about masks?
So this is a great question because the guidance on masks has changed during the course of the pandemic. So back in March, when things were first getting started, both Dr. Anthony Fauci and the Surgeon General actually said not to wear masks because the risk-benefit ratio didn't favor them. We were more likely to touch our face and make ourselves sick. And 3 things were happening. Number 1, there was a shortage of masks for healthcare workers who needed them the most. Number 2, the cases in the community were low. And number 3, we didn't actually realize the extent of asymptomatic spread occurring, that people who weren't showing symptoms or feeling sick were actually spreading the virus. So, of course, as you've seen, all of that has changed over the course of the pandemic because the science changed and evolved. But it's important to recognize that this is not the scientists wavering. This is not the scientists changing their mind. This is science evolving and recommendations getting updated accordingly. And that's something we do all the time in the scientific literature. We update our guidelines on a constant basis.
All right, Dr. Kohli, appreciate you coming on and breaking that down. Thank you.